welcome back to my channel. It's Dr. Micah Yu with My Autoimmune MD, and today we're going to be talking about ankylosing spondylitis. So what exactly is ankylosing spondylitis? Your friends might have it, you might have it, or you might have heard it in the news as well. Ankylosing spondylitis is an immune-mediated attack on the body. Ankylosing spondylitis is a type of spondyloarthritis, and there are multiple forms of diseases in the family of spondyloarthritis. So ankylosing spondylitis is one of them, and it does manifest with joint pain that can range from the TMJs all the way down to the foot. But classically, it likes to attack the back. In order to get diagnosed with ankylosing spondylitis, you have to have some manifestation of the back. So it can attack the lumbar spine, it can attack the C-spine, and the thoracic spine. But what we look for in rheumatology is attack on the sacroiliac joints, which is the bones below the lumbar spine. In rheumatology, we look for something called sacroiliitis, meaning we look for inflammation of the sacroiliac joint in order to diagnose someone with ankylosing spondylitis. Ankylosing spondylitis can also present with joint pain and inflammation of the hands, the feet, and so forth, along with stiffness as well. But usually this comes along with the ankylosing spondylitis attack on the back. So what symptoms clues us into a possible diagnosis of ankylosing spondylitis? Well, usually what I look for is stiffness of the back, usually the lower back, but it can be stiffness of the neck as well. That can maybe last longer than 30 minutes, maybe to a whole day. Patients usually get pain in the lower back area, and sometimes they even get pain on the buttock region as well. Some patients do wake up in the middle of the night due to the back pain. And some patients, they said, oh, I've been to many doctors over the years. This pain keeps persisting. And they said, I changed mattresses and it hasn't helped. What else could it be? And sometimes that is another sign that it could be ankylosing spondylitis, especially if you see multiple doctors and specialists and still haven't come to a conclusion. So I myself do have a form of spondyloarthritis called peripheral spondyloarthritis. So it's a variation of ankylosing spondylitis. I don't have the back pain, and I'll talk about my story in another video. So usually what we do in rheumatology to help diagnose ankylosing spondylitis is we get an x-ray to look for sacroiliitis. If the x-ray doesn't show something, sometimes we will proceed on to an MRI of the pelvis, looking at the sacroiliac joints. And sometimes we even get an MRI of the lumbar spine as well. But of course, if a patient is manifesting with primarily neck pain and neck stiffness, then we will get imaging of the C-spine as well. So there can be other organs that are involved associated with ankylosing spondylitis, and that includes the eye. The manifestation of the eye that we're looking for is called uveitis. And uveitis is inflammation of the uvea, which is part of the eye. And when this happens, the eye gets really red and it hurts to look, and especially look at the light, and the vision can be blurry as well. Other organs that can be involved is inflammation of the heart, with particular the aorta. The aorta is the largest vessel of the body, and that can get inflamed. Other things that can happen in ankylosing spondylitis is pain and inflammation, particularly of the axial area, the sternum, and the rib cage can also be involved. Another thing I look for is enthesitis. In the last video, we talked about entheses and psoriatic arthritis, where the connection point between the tendons and the bones are involved. So that can get inflamed also in ankylosing spondylitis. So they are at the elbows, they are on the shoulders, the knees, and the Achilles tendon and plantar fascia as well. Labs that we get for ankylosing spondylitis. So of course, we get our regular labs, the CBC, CMP, ESR, CRP. We make sure there's no other autoimmune diseases going on with the other rheumatology labs. And we make sure there's no other reasons for the lower back pain or back pain in general. One thing we do get is HLA-B27, and that's a gene test that you get at any lab. And when that's positive, it really helps with the diagnosis. But you can also have HLA-B27 negative ankylosing spondylitis as well. Treatments for ankylosing spondylitis, very similar to other types of autoimmune diseases that we treat in rheumatology, but a little bit different as well. So you have your TNF alpha inhibitors, which help. We also use interleukin 17 blockers, which includes Cosentyx and also Taltz. and we can use JAK inhibitors as well in certain situations. And those are just some of the treatments we have in rheumatology, but there are more coming out also. Sometimes the rheumatologist will just put the patient on NSAIDs such as ibuprofen to see if they get better. If they're better and there's no more problems, then they might not proceed to the other medications like the biologics that we just mentioned. So what questions do you have for me about ankylosing spondylitis? Do you or someone that you know have ankylosing spondylitis? Please hit the like button, subscribe below, and I'll see you next time.